All right. Today we're going to be finally addressing Cyclospora, what it is, how to treat it, what might be some symptoms, how it shows up, how to treat, recover from both a medical and a natural remedy perspective. All right, so Cyclospora is a parasite, all right? It's so small, you need a microscope to see it. It can be found in contaminated fresh produce, including fruits and veggies. It's just waiting to be swallowed. It's contaminated, unfortunately, through human fecal matter. So this is really unusual, but unfortunately is what we're seeing. Okay. How it gets into your body again is consuming contaminated fresh produce. Right now, they've identified is iceberg lettuce through Taylor Farms in central Mexico. It does not spread person to person. Okay. It's not like a cold, it's a parasite where you have to consume contaminated food. Now, what's different about this Cyclospora versus other stomach bugs is that the symptoms usually show up a week or two after consumption of the contaminated food. So, perhaps a stomach bug, you'll feel it right away. You have vomiting and diarrhea. This parasite, it actually takes a week or two until you start seeing symptoms. The delay is in part why the outbreak's been so hard to trace and also to find the source, but they finally have. This summer, the CDC released this past report from July that there's been 2,000 plus cases across 9 states linked to that one lettuce source. Now, there are 5,000 other cases nationwide that are still being confirmed, though, okay? The reason why this is breaking the news is because last year, total, there were 250 cases. Now, there's possibly over 6,000. So that's like 10 times more than what we saw last year. And so that's why these numbers are usually high and needs to be addressed. So what might you want to look out for on your plate? And of course, iceberg lettuce. Just avoid that right now. If you're eating any sort of mixed greens or salad greens, you want to cook that through. And if you're eating, fresh produce, berries, herbs, you really want to rinse that out best you can. Using apple cider vinegar, and if you have in your cabinet some baking soda, that's really going to help with cleaning things out if you take the time for that. All right, just overall, going to be helpful for you, especially with what's going on in our food system. Just really taking that extra precaution. Signs worth noting. All right, so this is going to be most frequent and most common one is the watery diarrhea. And with that, dehydration, fatigue, bloating, nausea, and lost appetite or weight loss. We don't often see vomiting in this one, or low grade fever, but again, it could happen. But you just want to really look out for the fatigue, the diarrhea. All right. How do we test for this? Okay. So there is a stool test that your doctor can test for in order to look for Cyclospora and any parasites. Now, this regular stool exam is typically microscopic, qualitative, and so they check to see if it's there. Now, that can be effective, but sometimes it can be missed. And so that's why I like using the GI map test, which is a PCR test. It tests for the DNA of the parasite. So we know exactly the number and the count quantitatively of what's in your gut. All right. But again, you can do that through me, or if you want to ask your provider for a stool test, they can check for that. Now, what is the medical path? What doctors typically do when they find a positive case for Cyclospora is to do it through antibiotics. Now, a combination of antibiotic of TMP and SMX is usually was prescribed 7 to 10 days and is very effective in treating the parasite. And of course, they're going to do fluids and electrolytes just to make sure. The difference between that and then a more functional difference is we'll perhaps often add a couple things. All right. So we'll one do the comprehensive stool testing, which is using DNA technology like a GI map test. We'll also consider antimicrobial herbs, right? Perhaps antiparasitic herbs that help with creating an environment where the parasite doesn't want to live. So that might include oil of oregano, berberine, garlic, walnuts, wormwood, black walnuts specifically, sorry, and golden seal. All right. That can be used alongside the antibiotic from the doctor or perhaps in place of antibiotics for milder cases. And of course, I'm going to be looking at someone's nutrition and making sure their digestive support, if they need to bring in some bitters or enzyme to if they have a weak digestion. Also, making sure that they're getting the nutrients their body needs to replenish, repair, and rebalance their gut. So, supporting from a recovery standpoint, we're going to rehydrate. Make sure you're hydrated with water, electrolytes. I'm going to repair the gut lining, perhaps with some bone broth, or glutamine, and perhaps even some aloe or collagen. That's going to be really helpful repairing some omegas, as well as rebuild the population of a healthy gut flora. So maybe that's eating probiotic rich foods or supplement as needed. And of course, rebalancing a lifestyle, a rhythm that allows your body to be able to have good rest, good stress management, eating whole foods so that you can really feed that good bacteria back into your system, and just really taking good care of the body. All right. So if you would like some personal support, go ahead and reach out to me. You can message me, DM me, or shoot me a text. And I look forward to connecting with you. Let's keep building together. I got you. Take care.